eminent panel members, Dr. Jain and healthcare leaders in the audience, a very good afternoon. Taking over from where Dr. Bala just spoke about NABH and the best practices, my talk today is around effective frameworks for health technology assessment. As you mentioned that it's very important to raise standards, but in addition to that, I personally feel in addition to raising standards, it's also about generating a lot of evidence to support those standards. So my talk is centered more around evidence generation and the importance of evidence in whatever we do. So it's very difficult to squeeze everything in a 10-minute capsule, but let me try and do justice. Quickly take you through some of the best practices. So the goal of healthcare obviously is to maximize the value for patients. Everyone, be it the healthcare provider, be it the payer, or any of the people in the healthcare space, everybody is working towards a common goal, including industry, including the device companies. All of us are working towards a common goal, and that is patient safety. So if our goal is common, and if we are trying to achieve that goal through different means, I think that's where all of us are in need of evidence. So just to share a couple of items that keep appearing in our newspapers, this is one where we talk about substandard quality. Again, going back to the point where the elevation of standards. So there's an article with blacklist 24 substandard drugs and devices. There's another one which talks about poor quality that aids our government hospitals. So in the light of all this, why do we want to measure quality? What is it that is what does quality mean to us? Outcome by and large is the ultimate validation of the effectiveness and quality of medical care. I'd like to share a very small example. Now, every procedure, irrespective of the specialty, in any kind of a hospital setting, the core objective is to deliver absolute high standard of quality health care at a reasonable cost. Now, what is that cost that we're looking at? And how do we define that quality, and what is the cost that we pay for that quality? Now, this is an example from one of the hospitals in India, and if you look at the X-ray, this is more of a fracture fixation case. The patient in the first X-ray you see had a fracture of the femur, and one particular plate was introduced and the first surgery happened. On the second day of weight bearing, that particular plate, if you look at the second X-ray, that broke. I mean, how can something that is supposed to support the fracture, the plate itself break? But that has happened in the X-ray we clearly see, and the patient had to undergo a second surgery. Unbelievably, after the patient was discharged, around a month on full weight bearing, the second plate also broke. You can see the third X-ray, and he had to undergo the third surgery. During that surgery, when the plate was extracted, and that's what you see at the bottom, the plate itself is bent, you can see that, but more importantly, can you look at the screws that have gone into the plate? Each of them has a different head diameter. There's a mismatch between the plate and the screws, and if you look at the length of the screws, each of them are different length, and if you see the number of threads on each of the screws are different. Now, I don't know how many of you sitting in the audience have experienced this. I've been with the orthopedic division of Johnson & Johnson for 7 years. This was absolutely a regular kind of a phenomenon. So is this what we are looking at when we say low cost and we go for low cost products, harping upon quality, and we say that we are going to extend that quality healthcare to the patient? This is what the patient undergoes, 3 surgeries, and I don't have to tell you how inflated the whole cost package would have gone up and the kind of trauma that the patient would have undergone, just because there was no evidence to support the use of this particular plate or screw or whatever the device that has been implanted. So what's the right framework or tool, if you ask me? I mean, we have been talking about health technology assessment on every forum. A lot of people have been speaking about it. This is nothing but a systematic evaluation of properties, effects, impacts of health technology. It has got direct intended consequences as well as unintended or indirect consequences. What does HTA do for us? It improves the allocated efficiency by enabling the policymakers to make informed decisions. That's the most important part. So when we talk about the evidence that is supporting or backing any kind of a new technology, what it does is it is enabling all the people in the healthcare chain to make informed decisions, to take those decisions which are going to be in the interest of our patients, which is ultimately the goal that I shared in the first slide. It's all about improving the patient's outcome. It also promotes the introduction and innovative cost by effective medical technology. Obviously, since the morning we have been looking at various technologies which are bringing a lot of efficiency. by bringing or raising the standard. So that's what health technology assessment does for you. And obviously, pivot the uptake of technology with little beneficial value. I mean, technology is not introduced to reduce the value, but obviously to enhance the value. So this is what the framework of HTA speaks about. So when I look at the two things that come out very clearly are, one is the clinical-based outcome measure, which is your direct benefit which you see absolutely upfront. This is what Dr. Kaka just mentioned about surgical site infection, length of stay, how long does the patient take to recuperate in the hospital, what is the mortality, is there a revision, as I showed in the X-ray. There were 3 surgeries, there's a revision, and what is the kind of the revision rate that we look at. Range of motion, if you're looking at a knee implant surgery or something of that sort, what's the range of motion? If you're correcting a deformity, looking at radiographic assessment. So these are the clinical outcomes and the measures of clinical outcomes which are absolutely direct. These are the ones that we look at when we do a health technology assessment. In addition to this, as I mentioned, there are patient-reported outcome measures. These are the indirect ones. We're talking about the functional status, the pain, and the various scores that we have in play. Like for a knee pain, there's a knee score that is in play. There's an SS36 score. There's an Oxford orthopedic score. Different kind of scores. The dash score for the arm, shoulder, and hand. So these are the indirect outcomes, the measures that we normally look at when we're talking about raising the standard. So surgeons, hospital administrators, and medical device, I think it's nothing but, if you look at HTA, it's all about all of us coming together. So generation of evidence based on all that we just looked at, it's all about the medical fraternity, the administrative fraternity, and the medical device companies coming together to ensure patient safety, effective surgery outcomes, and obviously the final outcome is to reduce healthcare costs. So that's what I thought as a very small and very crisp presentation to talk about HTA, and thank you for your attention.